Hello everyone, my name is Yohanca, a student from DKIT, and my presentation today is entitled A Medication App for Older People Attending a Heart Failure Clinic. Population is aging globally and Ireland is not exempt. And while increased longevity is a very welcome development, it presents with the challenge of an increased demand for care. Cardiovascular disease is a leading cause of death worldwide, and heart failure rates are on the increase in Europe. In addition, multimorbidity is the rule rather than the exception among older patients with heart failure. Heart failure treatment is complex, and polypharmacy and medication titration are common challenges associated to self-management. Evidence suggests that the use of apps is on the increase and can enhance patient-provided collaboration. In the current context of the COVID-19 pandemic, when social distancing measures are ongoing, mobile health has never been so important for treatment. The need for new models of care in this changed environment to support older adults at home is especially timely. So phase 1 was completed and was conducted in a heart failure clinic. It involved semi-structured interviews with staff, followed by 2 questionnaires. Observations were conducted over 5 days and allowed me to become more immersed in the clinical setting to observe what worked and what did not work so well as to identify day-to-day challenges for healthcare professionals delivering care. Semi-structured interviews were analyzed using thematic analysis, and 4 themes emerged from this data. On theme 1, healthcare professionals raised some concerns about older patients using technology and availability of this technology to older people. On theme 2, healthcare professionals stated that older patients may not be able to cope with the technology or comply with technology. On theme 3, participants agreed that an app to support patients with medication is an opportunity for a new model of care. And on theme 4, some of the challenges experienced by staff were poor time allocation and a very heavy caseload. Another key finding, this time from my observation, was around medication review. Patients were not coming to appointments with their medication list as requested by healthcare professionals. And this delayed appointments considerably and disrupted the clinic efficiency. So consultations were taking longer. For this reason, I decided to concentrate on an app that allows heart failure patients to keep an up-to-date medication list to show to healthcare professionals at appointments. Phase 2 is also completed. And in phase 2, I conducted a review of the Google Play and iTunes app stores to identify commercially available apps with a medication list functionality. Then I conducted a second review in the peer-reviewed literature to identify apps with a medication functionality used in different settings. In both reviews, inclusion and exclusion criteria applied. This figure presents the summary of findings of the Google Play and Apple Stores review. In total, 9 apps were included. Whereas this second figure summarizes the review of the peer-reviewed literature. 19 academic articles were included, and the review aimed to identify studies where medication apps were used in practice and with what outcomes. The apps identified were evaluated using the Mobile App Rating Scale, or MARS, a widely used tool to evaluate the quality of apps. 5 researchers collaborated on evaluations, including 2 PhD students, one from Highlands and Islands University and another from UU, and an academic paper is in progress. The aim was to identify the optimal app so I could use it for my phase 3. And of interest to note that there is no published paper using MARS to assess the quality of apps with a medication list functionality. My proposed My proposed program of work for phase 3 is a work in progress. And in phase 3, 8 heart failure patients will use the app for 3 months. Semi-structured interviews will be conducted with staff and patients pre and post intervention. For patients, some measures will be assessed at baseline and at 3 months follow-up. And this is the end of my presentation. Thank you for listening, and I'm looking forward to hear from other students about ideas for further collaboration. If you have any questions, please feel free to ask. Thanks.